Hello and welcome to the Coping Cafe. I'm Dr. Joe.
I'm Dr. Michelle.
So today we're going to be talking about children accessing special services at school. In our practice, we have a lot of parents who will come in and if their child, different things like maybe they're struggling with ADHD or have anxiety or a learning disability, right? And the parents want to advocate for them so they can succeed. And it can be very overwhelming.
It is a very overwhelming process when your child is struggling with things.
Oh, sure. And you want to help them. So today, and we're going to have a whole series, we're going to be talking to Dr. Michelle. She does neuropsychological testing and just general psychological testing, kind of the expert in this area. So I'd like Michelle to walk us through. I got my handy dandy questions here.
Oh, all right. Very official today.
Very official. So let's start with what kinds of kids would qualify for those services?
So all different kinds of kids. So it's not just one particular child. Sometimes there's physical ailments, things like diabetes, thyroid, could be very serious, cerebral palsy, anything like that that interferes with academic, social, and emotional functioning. But in general, and those kids are pretty apparent, meaning that most schools already say, oh, you know what? They can see it, they can identify it, so let's help them and give them services. So then you move down to kids who have more subtle things, like say a learning disability, auditory processing, visual processing. And those things are a little bit harder to see. So many times people do diagnostic testing, the kids are flagged on general testing. The next part of that is what they call OHI, and OHI is a fancy word, just means other health impaired. And that could be ADHD, could be anxiety, depression.
So that's a whole umbrella term for all of that.
Lots of things, whatever, it's like other identified things.
Yeah.
And so I think that's where parents can find that they can get services, help their child. And so if your child falls into any of those categories, generally if it's the physical part of it, the school will generally already know that. But there are some physical things like visual tracking or auditory processing, minor hearing disorders that they're a little more subtle. They haven't been identified yet, and they interfere with functioning.
What about, okay, so you use these terms, and as psychologists, we're familiar with them, but just to break it down for the layman, you say auditory processing disorder. What does that mean in layman's terms?
Okay, so when auditory information comes in, you might not be processing it the same way that you or I might. So what that means to some people, it could mean also there could be distortion in the way you hear phonetics, the way you hear language. Could be sequencing where it's a little bit slower to process. Do you know the little, if you look on your computer and you see that thing going round and round?
Yes,
and
infinity hell,
yes,
right.
exactly, and you're waiting for it to kind of just start. And you're like, come on, load my Amazon. But, and I want my cart. So what that is that sometimes when kids' input is coming in auditory, that it's a little bit slower. So as they're hearing the first part, someone could be going on to the second part, so they hear maybe the first part and the third part. And so parents are sure that they're just selectively not hearing things, they're not paying attention. And so sometimes there's things that sometimes even people think is attention deficit disorder, which are actually underlying learning disabilities. So it's really important to make sure that you know what you're looking at. But it's not just one particular person. And, as we go on through this series, we'll kind of keep talking about what kind of services are out there. All different plans are available to parents. There's a lot of things that are under the law that kids are entitled to, and we want to make sure that they get the best education that they can and that it meets their needs. And sometimes that takes figuring out what's going on with your children.
So, and I think too, for parents that utilizing services, going to see a psychologist, get testing done, see a therapist that can advocate and be a part of, walking you through and navigating you through that process.
Absolutely. And I think that as we go on to explain things, I think you'll more understand what the process is for that. So I was thinking that, as we're going through this, we're just talking about who gets services. Now let's talk about, going on to in our next session, why don't we talk about, what those plans look like what is an IEP? What is a 504? So what I would like to do is have everybody kind of join in again.
Absolutely.
And we can
So this is Dr. Joe signing off.
This is Dr. Michelle. Have a great day.
Take care.